Good morning once again, everybody.
Good morning, doctor.
I did introduce myself earlier. I'm Christina Namatovu. I'm a doctor and a wound care specialist working at Chirudu Hospital in the burns unit. So I will just quickly rephrase the question posed to me, which is, can you describe the range of treatments needed and available for acid attack survivors? And what are the obstacles to full medical and emotional support? Now, as you know, in medicine, we always work by processes and procedures, and we always go from basics. So that's exactly what I'm going to do in answering this question. We technically work with about what we call the levels of prevention with any disease that we work with, whether it is acid attacks, whether it is malaria, whether it is whatever disease you can think of. This helps us to be systematic and make sure that we haven't lost out on any steps. So quickly, the first level is always the prevention level. So with acid attacks, the biggest prevention level we have, or that we should have, are the laws, which should govern the procurement, the distribution, the storage and the use of acid and other chemicals. And also we should have laws about sensitivity on certain issues, and these are the issues which greatly contribute to gender-based violence. One of them being conflict resolution. Many people are terrible at conflict resolution. They believe that might is right. So if I have the strength, then I should be able to subdue everybody under me to what I want them to do. And then the second contributor to gender-based violence is empowerment. Mostly gender-based violence occurs to women. As we've seen, it happens to women and children, and this is because they are the least socially or economically empowered in society. There are a number of laws which may contribute to the control of acid and other chemicals. I can maybe quickly go through them. One of them is in the Penal Code, the CAP 120, Section 216. We have the National Environment Act, CAP 153. We have the National Bureau Act, CAP 327. We have the Control of Agricultural Chemicals Act, number 1 of 2007. We have the East African Community Customs Management Act, number 1 of 2005. We have the Occupational Safety and Health Act, number 9 of 2006. We have the Investment Code, CAP 92, and then we also have the International Rotterdam Convention, which Uganda ratified. So whereas we do not have a specific law for acid management or chemical management, we should be able to work within these laws. The second level of prevention is what happens when the acid has been thrown and this person has been abused. And this is basically what we call management of the outcome of the incident. It comes at different levels. First of all is the first aid. Now, first aid does not mean you carry this patient to a health unit. First aid happens where the incident has happened. The first aid for chemical attacks, the first aid for acid attacks is water. Water, 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 water. Plain water. Nothing else. And to quote one famous doctor, the solution to pollution is dilution. Okay? So if the person has been attacked by acid, pour water on them and let that acid run off. The challenge we have is with our locally learned behaviors and beliefs. We put eggs, we put transformer oil, we put cat fur, we put sackcloth. Now, when you do this, you are not helping this patient. You're actually preserving the heat inside. What the Baganda call okuboreza. Okay? So whatever burn it is, not just chemical burns, you are okuboreza this patient. You're adding on to the injury rather than helping. So the first aid is water. Now, for chemical burns, unlike the other rest of the burns, where you have blisters formed and these blisters burst, and the patient actually starts to feel cold. With acid burns, it actually does what we call coagulation. You know, when you fry an egg and it goes from being liquid to being solid, that's what happens to the skin. So you only have a time limit of 30 minutes. If you're very lucky and the acid is dilute, 40 minutes to do your water therapy. If that 40 minutes passes, the skin has caught, and even if you put that patient in a tank of water, you are not going to be able to help them. The unfortunate thing we have is that most of these acid attacks are premeditated, they are planned. So this person who is doing it knows who they are doing it to very well. They time them, and it's always done in a place where they cannot get immediate help. It's in an alleyway, it's in a dark corner, it's at the gate of a home, it's in a vehicle. So we always lose that first 40 minutes. Very few patients get to us within that time period, which is a problem. So after you've done the first aid, it has happened, what is the next step? The next step is the preservation of life. As we've probably seen and noticed, most of these attacks are to the face, head, neck, face. And this is where we have vital organs. You have your eyes, you have your nose, you have your mouth. And should a person have been screaming, they'll probably have opened their mouth, which means they're going to swallow. So the first thing you do is preservation of life. How do you preserve life? Observe this patient. Did they ingest? If they ingested, make sure you protect their airway. Make sure you protect their throat. Okay? So as you do this, because with acid and all this, the swelling will occur. So if you're not able to protect their airway, the swelling can occur to such a point that the patient dies of suffocation because they cannot breathe and not because of the acid. Then we also have to control what we call the hemodynamics, the blood, the general state of this patient. What is their blood pressure like? What is, all these circumstances of life. So you have to make sure, is this patient, one, you've made sure they can breathe. Two, you have to make sure, is their blood pressure okay? Is the patient bleeding? If there's bleeding, control the bleeding, All these come in as we're trying to preserve. We're not even thinking about the wound first, because it's no use thinking about the wound when you don't know if your patient will live. So usually they are large burns, so we know we have to give like IV fluids. These are things which are done instantly, okay? So we give the IV fluids, you stop the bleeding. Now, if the patient has reached a health unit, because we know that this what we call the coagulation the skin has held, it may sometimes impair some of these facts of life. So if it's along the chest, it may impair their breathing. We have to cut through it. This is not something that can wait. It has to be done immediately. It may be among the limbs, so you have to work on this immediately. So after you've done the first aid has been done, you've preserved life, you now know your patient is going to survive, then you come to preservation of function. Yes, your patient is alive, but what functions are they going to be able to remain with? If the eyes are involved, how you have to take steps to make sure that you can preserve sight. Sometimes it is impossible. But when you can, especially if you get to this patient early, like we mentioned within the first 40 minutes, do your water, do your everything, make sure preserve sight. You have to protect the limbs. Like we remember at the beginning, most people do this aiming to disable this person. May not necessarily want to murder, but they want to get this person out of commission. So they'll go for the head, the face, the limbs. You have to protect the limbs. So after this, we have the adjunctive treatment. So now we know our patient is alive. We know we've protected the limbs and everything. We do the wound care now, because eventually this tied up, this burnt skin is going to come off and leave the patient with a very large wound. So now we have to come to closure. How do we close the wound? This is also, it's not a one-time thing. It happens, as the survivors will tell you, it's a multiple surgery kind of thing. It doesn't happen just once. So you cannot say that we've done this once and we are done. Some are lucky that way, but most are not. Along with wound